pull it away, please. Pen light here again. And this side, same thing. Good evening. I'm Dr. Shield. This evening I'm going to be performing a brief and quite relaxing cranial nerve exam on your Cubone here. I'm going to be taking it through a variety of tests and just procedures that help us ensure that your Cubone is battle ready and healthy enough to join you on your Pokemon journey. How does that sound? Okay, great. Well, you can just get comfortable, watch along, and just try to relax a bit yourself if you can. Well, I'm going to go ahead and get started, and hopefully we can send you on your way very soon on a very successful Pokemon journey. Alright, well, just sit back and relax. The first thing I'm going to do is just get your Cubone just used to the touch of my hand. That way it remains calm and comfortable during the process. It looks like it's brought along its bone club here, which is fine. Oftentimes we let Pokemon bring items or things in that make them feel more at ease. So, Cubone, how are we doing this evening? Good, good. Well, it looks to be quite relaxed for the normal Cubone species. They are oftentimes a bit apprehensive and protective, defensive, as can be expected with their background and traumatic history. So oftentimes with Cubone we try to practice just a bit more care and just comforting tone and touch. So I like to make sure that it's prepared for any parts of the procedure. Alright, I think we can begin. The first thing I'm going to do is just start with a slight pupil dilation examination. As you can see with that light, I'm just going to be shining this in the eye of your Cubone just briefly. Don't worry, it won't blind it or cause any kind of long-term issues whatsoever. I'm just looking for those pupils to dilate and constrict whenever the light comes in contact with it. This shows a healthy function of the brain and vision systems. So I'm just going to take it through just a few small practices here. So Cubone, I'm just going to shine that light. It's off and on, and I'm just looking for changes in the dilation of those pupils. On and off. On and off. On and off. On and off. Once more. On and off. Alright, and to the other side here. On and off. On and off. On and off. On and off. Once more. On and off. Perfect. Cubone, how are we doing? Excellent. Okay. So now I'm just going to be passing that light briefly past the eye, and I want to see a similar dilation of the pupils and then a return to normal as that light passes by the eye sockets of the helmet-like cranium of your cubone. So, just like before, and there we are. Good. Back. Good. Back. Good. Back. Good. And once more. Back. And that's perfect. Great job, Cubone. And to the other side here. Back. Good. Alright. Another pass. Good. Pass. Good. Pass. Good. Pass. Good. Alright. Cubone, your eyes are looking great so far. So now I'm just going to ask you, Cubone, to follow the light here for me. I'm going to go from eye to eye, since Cubone's eyes are situated on the lateral sides of the skull here. And if you can notice that they are just ever so slightly inset inside that skull kind of helmet that makes up its overall cranium. A lot of people want to look at the, well, head underneath of the skull that it wears on its head as its true body, but we like to study and treat Cubone like the skull, helmet, and the actual cranium underneath is all part of the same creature, which scientifically, and that's a bit of a gray area, so we assume that all portions of the Cubone skull are in fact its primary skull-like functions. So what we're going to do is we want to ensure that those eyes on these sides of that skull are tracking properly, and that the blind spots caused by the inset of those eye sockets is not interfering with any kind of vision. Alright, Cubone, so please follow the light. Good. Good. Alright. Let's try to hold still just a bit. Good. That's great. Again. Good. And once more. Good. So what I'm going to do now, Cubone, I'm going to hold the light on your eye, like so, and then I'm now going to see if you can follow my finger with a bit of that light interfering with your vision there, and just see how it adapts. Alright, so please follow the finger here. Try to keep an eye on my finger, even though that light is shining in the eyesight there. Try to ignore the light as much as you can. And that's perfect. Let's try this side here. Same thing, and good. Just follow the finger right here, Cubone. Good. That's better. Good. All right, and there we are. Okay, that's great. Well, the eye function of your Cubone seems to be great, and I don't see any issues that should raise alarm or have any kind of cause for concern, so I think we should be good to move on to the ears. Now, what we want to do, Cubone have very peculiar senses of hearing. These nodules here are actually just residual horn-like structures left over from the skull of its mother that it wears on its head. So these, of course, laymen sometimes think that these are in fact the ears. That is obviously far from the truth. The ears are actually situated directly behind the eyes, the true eyes, not the eye sockets of the skull here, but the ears are located on the back portion of the head, and since they do have these portions of the skull that almost act as fins of sorts, it actually makes the hearing a bit more troublesome for Cubone, since of course not only are their ears located behind a bone helmet, but this extra portion of the bone-like fins here on the back of the cranium make it a bit more difficult, since there is that added layer of bone. So we like to make sure that your Cubone can at least hear at a moderate level. That way it can avoid danger and hear incoming attacks, things of that nature. So Cubone, what I'm going to do, I'm going to make some sounds on either side of your head, and I'm going to try to move it back to where you can't see which side the sound is coming from. And I just want you to tell me what side of your head that sound is coming from. Alright, we will start with just the bare fingers here for a very subtle sound, and then I will get some gloves that will make a much more rich texture sound. Alright? Perfect. Okay, let's begin. Which side? Alright. Okay. Good. Excellent. I tried to trick you just a bit there. Perfect. Alright, I can see that that's no issue for you. Let's get a bit of a unique sound. I'm going to use some textured gloves here. As you can see, they have a very nice, almost sponge-like texture on them, which makes for really unique sounds, and sounds that I find really imitate a crunching of grass, or maybe the shuffling through twigs. This is good for Cubone that are going to find themselves in a nature-enriched environment. It's good for hearing predators or potential dangers, as you can hear. The sound of a enemy arbok, perhaps, slithering through the grass. Would make a similar sound, or you have more hearty sounds like so. Perhaps that could be the footsteps of a potential Pokemon poacher. So, what we're going to do, Cubone, similarly to before, I'm going to make sounds on either side of your head. And just tell me which side you hear. Let's begin. All right. Okay. Perfect. Good. And the last one. Good. All right. Those sound receptors and overall auditory abilities of your Cubone seem to be up to par, and I wouldn't worry about its battle readiness in terms of auditory function. I think that the ears, though, dampened slightly by the skull-like helmet cranium there, I think it still functions at a level that will make it capable of battling respectively. Alright, and of course the true strength of a Cubone comes in its attack power instead of its defense after all. Alright, well, next I'm going to keep my gloves on for a few of these other procedures just because it helps me get just a bit more grip on the Cubone's bone-like structures here when I need. We're going to test the reflex and strength of the fine motor skills of your Cubone. So Cubone, I'm going to try to hold the bone club here. So I'm not going to take it from you. I'm just going to hold it for just a bit, so don't worry. Good. Alright. So Cubone, as you maintain hold of the bone club there, I'm just going to do a few movements here, either pulling it away from you or pushing it back towards you. I just want you to resist whichever direction I'm pulling, okay? Alright, so first, Cubone, I'm going to pull or attempt to pull the bone away from you. I just want you to resist and fight against my pulling, alright? Okay, so Cubone, are you ready? Begin. Fight, 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 fight. Ah, good. Don't let me pull it away, please. All right. Begin. Fight, 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 fight. Good. All right. Let's get a bit different grip there. All right. And fight, 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 fight. All right. That's great, Cubone. You're doing wonderful. All right. And fight, 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 fight. All right. Cubone, you are a lot stronger than I was anticipating. Usually I can do this without losing breath, but you're quite the fighter. All right, once again. And fight, 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 fight. Excellent. Cubone, that was wonderful. All right, so similar to that last action, now I'm going to attempt to push the bone towards you. So I just want you to resist and now fight against me. This will test the anterior muscles here, which allow your Cubone to press forward and move its extremities in a forward motion away from the body. All right, Cubone, are you ready? Perfect. And fight, 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 fight. That's great. And fight, 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 fight. Okay. That one, I think, was just a bit weaker, so let's test that one again. And fight, 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 fight. That's great. All right, again. Fight, 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 fight. Perfect. Okay. And once more with this angle here. And fight, 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 fight. Okay. So I am sensing just a bit less resistance with the anterior muscles. So the one thing that makes me wonder, has it sustained any kind of injury to the back? Has it taken a nasty headbutt or maybe a high jump kick, karate chop to the back? Anything like that that you can remember? A rock throw, perhaps? Okay, so it did have a rather difficult battle with a Geodude. Okay, well that explains it a little bit. And of course it took a hard hit to the spine there. Well, it doesn't look like it's been a serious injury, but it might have just a bit of soft tissue bruising or contusion there on that anterior portion of the body, which might be just ever so slightly weakening that motion there. It was subtle, but I did sense just a bit of it. But nothing to worry about, Cubone. You did absolutely fantastic. Should heal up in just maybe a few days, so I wouldn't worry about it. Alright, Cubone, that was excellent. Okay, so the next thing that I'm going to do, I'm going to use my trusty pen light here again, and I'm just going to do a brief spot check of the skull cranium here, just to check for cracks or chips in the bone. Oftentimes with these skulls that Cubone wear on their head, there can be damage or injuries that were sustained to the previous owner of this skull that might weaken the integrity of the structure itself. So I'm just going to do a brief visual exam and just make sure that everything looks good. Alright, that's great. Don't see anything there. That's good. And just near the nostril holes here. Perfect. Okay, that's one thing that we rarely have to test with Cubone. Usually, since the nostril holes here on the skull that it wears are so large, usually the airflow from the aerodynamic design of the skull really allows a lot of that air to permeate through the skull and into the shorter snout, which usually ends about here on the true head of the Cubone. It allows ample air to flow through that skull. So usually the sense of smell is quite robust. So the last thing that I'm going to test is just a bit of tactile. I want to make sure that the tactile sensory sensations on each side of the Cubone's head and arms are the same on each side. So Cubone, what I'm going to do is I'm just going to use these textured gloves to do just a gentle motion on one side or the other. And I just want you to let me know if either side feels vastly different than the other. Alright? Perfect. Alright, this side first. Good. And this side, same thing. Any notable difference? Good, and we're just going to move up a bit. Good. And this side. Good. Perfect. And just stop me, make a sound or anything like that if there's anything that's out of place or out of the ordinary in terms of sensation. Good. Just along the snout here. Good. Any difference? Okay, perfect. Alright, and now down the arms. Good. How's that? Perfect. And on the sides of the legs. How was that in comparison? Alright, great. Now I'm going to do both sides simultaneously. Let me know if there's anything that stands out to you. Good. Alright. Perfect. Arms. Good. And legs. How's that? Perfect. Alright. It looks like the tactile sensory response is excellently balanced between the sides of the body, which is a good sign. Sometimes with those interior injuries to that spinal area. We can worry a bit about nerve damage, but Cubone doesn't seem to have any indicators of that, so that's great. Well, with that said, the few suggestions that I have, obviously the injuries or deficits with your Cubone are extremely subtle, nothing to worry about, but there are a few generalized training tips that we usually give to trainers of Cubones. The first is that field training in meadows or open field areas are generally preferred by the Cubone species. They like to make sure, since they are a bit skittish, that they can see their surroundings clearly and that there's no shrubbery or forests that can be used for a predator or attacker to sneak up on them. Beyond that, it's usually good to try to acclimate your Cubone around other Cubone of similar age. It seems like Cubone who spend time around each other usually adjust a bit better to that sense of loss and loneliness that they can sometimes experience. So the last is that if you do need another species of Pokemon to try to comfort your Cubone with, Kangaskhan make great pairs, since they do have a natural parental nature to them, and they are often very inviting to Cubone who have been orphaned. So if any of those are capabilities or options for you, I highly suggest it. Any questions? All right. Well, thank you so much for bringing your wonderful Cubone in. Cubone, thank you for allowing me to treat you this evening and being such a great sport about it. Please let me know if there are any other concerns or if you have any other Pokemon in the future that need treatment. All right. Well, please do take care, and Cubone, it was a pleasure. Good evening.